All right, we got lots to talk about today, June 3rd, a bunch of stuff in the news. So I'm going to go over, usually I talk about one topic, talk about it for about 10 minutes, and then I open it up to live Q&A. I already have a bunch of questions there, but I want to s- try something else. We'll talk about 4 or 5 different topics. We're going to talk about some extra help for seniors out there, some volunteer opportunities. They're technically listed as volunteers, but actually you might make some money on it. My office used to use it on a regular basis. So let's go out there and get that money while it's still there. We're going to talk about some scams going on out there. We're going to talk about the Social Security AI phone system. Not a lot of good word on that. We're going to talk about a bill that was just introduced in Congress to actually save Social Security. Well, make sure we don't get cuts in the future. So we'll talk about that. Medicare Advantage letters that are going to be going out here probably this month or so. So if you get those, you'll know what those are all about, that they are not a scam. And we'll talk a little bit about student loans. Okay, let's get into this. Again, this is also a live Q&A. If you got any questions, make sure you type it in. If you're watching this on a recording later, make sure you subscribe and like and share and all that kind of good stuff so you catch us in the future on our live. Okay, so extra help, some extra money out there for people, for seniors. This is a Department of Labor program, but it's administered through AARP. It's called Senior Community Service Employment Program. And basically, what it is my office that I ran, the Social Security office that I ran, we used this more than all 1,200 offices put together. That's why my office is one of the most efficient in the country, because we did things like this. We used veteran volunteers, and we also use senior volunteers. So basically what it is, you contact your local AARP or you Google Senior Community Service Employment Program. And again, it's from the Department of Labor. That's where the money comes from. About 90% of it comes from the Department of Labor, and the other 10% comes from AARP. So with all the budget cuts, it might be a good idea to get in there as soon as possible to get that money. So what it is they tie you up. They put you in a federal office, sometimes a county or state or something like that, a government office. So you go in there and volunteer. And so that's what we used to have. They do like a 6-month rotation or so. You could extend it for another 6 months. And you go into whatever office, the FBI, the EPA, the Social Security Administration, your local law enforcement, or whatever the case may be, and you volunteer. That agency doesn't pay you, but the Department of Labor, the Senior Community Services Program, does pay you. So that is an opportunity a lot of people are missing. And unfortunately, a lot of Social Security offices throughout the country aren't taking advantage of that. It does take a little bit of paperwork on the Social Security managers' part to do it, but hey, that's their job. So get it done and get help out there for customer service, particularly since there's so few actual Social Security employees out there anymore. Okay. Another thing out there is a bunch of scams going on. This is Social Security brought a bunch of stuff to the forefront. You got with AI, the scam phone calls are increasing even more. And it's basically just a robot in there. These AIs are able to call unbelievable amount of numbers at the same time. And one of the new things, it calls you up and asks you just a really basic question. And if you answer yes, they've got your yes recorded, so they can do all kinds of other strange stuff with your voice, just by saying yes. So anytime you get anything like that, if it doesn't come from a number you recognize, please avoid it. Even when I worked at Social Security, I used to get calls all the time, saying they're from Social Security, saying, hey, they're going to shut down my Social Security card or whatever the case may be, or they're going to come out to and arrest me or whatever. And I always had fun harassing them because they didn't know anything about Social Security. And then as soon as they found out I worked for Social Security, they obviously hung up. So watch out for the scams out there. Speaking of AI, the new commissioner of Social Security said one of the ways, because they, vacated so many people from the agency, and now, when you call up, you got a 3 or 4 hour wait if you're lucky. And so they're going to be introducing AI, artificial intelligence, to help you answer your questions. But so far, it's terrible. There's been a bunch of news outlets that have called. I've tried calling and talked to this AI, and it just puts you in circles and circles and circles. So maybe there'll be a place for AI in the future, but I don't think human beings will ever be replaced, because once you retire, this is a once in a lifetime thing. You wait 60 plus years to get your retirement benefits, or if you're unfortunate, have to file for disability benefits. That's a once in a lifetime thing. And you don't want to have to talk to a computer. You want to talk to someone that knows something. So hopefully, they bring in these technologies to kind of assist. But I think we should always demand that, hey, we paid for customer service from Social Security. We expect to talk to a human being. Okay. And there is another good thing out there that was just introduced. This is so Congress.gov. It's Senator Sheldon Whitehouse out of Rhode Island just introduced this recently, and it is called the Medicare and Social Security Fair Share Act. And a lot of my regular viewers know what this is all about. This is basically one of the reasons that Social Security we're all going to get cuts in the future. About 20% cuts in about 7 to 8 years is because the trust fund is running out. And, the trust fund was never meant to be there forever, but the trust fund is running out. And once it runs out, that 20% gap between what comes in and what goes out, there's nothing that could be there to fill that gap anymore when the trust fund runs out. So the reason we're in these dire straits is because most of us, when we pay our Social Security FICA tax, the payroll tax, we pay it on every dollar we make. But if you're making $1 million, anything over $176,100, you no longer have to pay FICA Social Security tax. You're exempt from those taxes. And usually if you make that kind of money, you've got a great little accountant, you're probably exempt from a whole bunch of other taxes too, but I won't go into that. But the fair share is basically everybody pays their fair share. If you make $50,000 a year, you pay FICA every single day of the year. If you pay $5 million, you probably pay FICA taxes for the first 15 minutes in January 1st. So this Fair Share Act basically said, no, that's not right. Everybody should pay their fair share. One of the things politically is it says anything over $400,000. So I guess it's going to be whatever the limit is for that year. For instance, this year it's $176,100. Anything over that, you don't pay into FICA, Social Security anymore. If this passes, so the $176,100 to $400,000, that's still a DID zone where you don't have to pay FICA taxes. But anything over $400,000, you will have to pay FICA taxes just like the rest of us. And there's also an addition in there about those people that, don't work, don't get W-2s, they're not self-employed, or they get capital gains or investments, and they're, working on Wall Street, and, they make tens of millions of dollars, but they don't make it the way you have to pay FICA tax on it. So they avoid all those taxes, completely. And this closes that loophole. So make sure you reach out if you're interested in something like that. Reach out to your politician and tell them, hey, support the Medicare and Social Security Fairness Act. This has been introduced in various forms for decades, because we've known this issue was going to come with the Social Security cuts. And we just keep kicking that can down the road, unfortunately. All right. Another thing that's going to happen here this month or next month, you're going to start, if you have a Medicare Advantage plan, you're going to get a letter from your Medicare Advantage plan company that says, hey, you've got our plan, but by the way, you've got dental benefits you haven't used, you've got gym membership you haven't used, you've got transportation benefits you haven't used, you've got vision benefits you haven't used. Maybe you should consider using those. So this is a brand new thing that started this year. These letters have never gone out. This is a brand new thing that the government has come down and said, hey, Medicare Advantage plans, you offer all these different, benefits and bells and whistles, but it seems like a lot of people aren't, using those. Why? Is it because you're not telling them? If that's the case, you need to start sending out these letters and start telling people that, hey, there are these extra benefits. So you're going to see those letters coming again if you have a Medicare Advantage plan. All right, another big thing that just passed is student loans. So now student loans, it's back on. If you owe money, if you're in default in a student loan, you can get your with Social Security benefits withheld. It's up to 15%. So if you're in default in a student loan, you just might receive a letter. You'll receive the letter first. It'll come from the Social Security Administration and it'll say, hey, we've got notification that you have a student loan in default, and we are going to start withholding 15%. And Social Security can't do anything. If you call Social Security and say, no, 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 I don't have that. I paid that off. I can't, whatever. Social Security can't help you. You have to call the loan servicer. So wherever you got that loan from, Department of Education, whatever system you got it through, you have to contact them. Social Security cannot help you. They just get notification from the other agency of the federal government that you're in default, and they have to start withholding 15%. There is an exception. If you're receiving SSI, supplemental security income, they can't withhold anything if you're receiving supplemental security income, because that is a welfare-based benefit, needs-based, and the max you can get on SSI is $967. So they can't withhold anything from that because it is a needs-based program. But anything else, 15%. There is also kind of a floor that if your regular disability benefits or retirement benefits are under $750, then they can't touch it if it's under that amount. But if you're only receiving $750, I would definitely check to see if you're also eligible for SSI, the supplemental security income. And if you have any questions on what SSI is, you can check out my website, MyGovExpert, and I've got a new section on SSI. It tells you exactly what SSI is, how you get it, how much can you get if you're receiving benefits, how to avoid problems and keep your SSI, and the fact that you can get SSI and retirement benefits at the same time, and disability benefits and all the rest of it. So check out my new website on there. I will pop up the link. There's the website, mygovexpert.com. It's got all your information on all things Social Security, retirement, disability, survivor benefits, all the rest of it. Okay. All right. So we've gone through the news pretty quickly, about 12 minutes, and that way we can get to as many questions as we possibly can. All right. Let's see. A Kitty B. Does 20-year active duty veteran, 77 to 97, need to submit a DD-214 to Social Security to get additional funds credit for this? How would we know if they did? Okay, so the early part, the 77, early 80s and stuff, when you file for your Social Security benefits, retirement benefits, disability benefits, whatever the case may be, they will ask you at that time. They said, you ever serve in the military? And if you said yes, then they will put your dates in there. And if it's at a time where they do give you an extra little bit of credit, it's not much. But if it's at a time that you do get a little bit extra credit, they will include it at that time. Sometimes they will request to see your DD-214, but nowadays it's pretty much automatic. The Social Security system interacts with NARA.gov and with the VA system, and they're able to do that automatically. But if you are unsure whether you included your military service when you filed for benefits, just call Social Security, call the 800 number and say, hey, was my benefits included in there? My time in the military included in there? And they'll be able to tell you. So let's see, Robert, I have COPD and on albuterol. It was covered by my Medicare, and now it's not covered in 2025. I live in Kansas. What changed? Yeah, so sometimes it's because the prescription drug plans are, those are private companies, and sometimes they say, hey, these brand names, it's getting too expensive. So they do these it's not a generic, it's called a biosimilar, where the formula, they make one that's similar. It's not generic, but it's kind of strange. So it sounds as though, maybe that particular brand name is not covered, but they probably have a biosimilar type of one. But if you go into my website, and go into the appeals section there, it'll tell you about Medicare Advantage appeals. So prior authorization, so you can do formulary and a formulary exception. So you just basically, you call your doctor and your doctor says, hey, they submit it to your Medicare Part D plan or Medicare Advantage plan or whatever the case may be. And they say, hey, whatever biosimilar or generic to this drug, it just doesn't work. It has other, the other reactions to it. This person has to have this particular drug. So you can request a formulary exception and also a tiering exception. So check out let me show you where that was again. So the appeals process, it's not under Medicare. There's a bunch of information about Medicare and Part D and stuff like that. But that would be an appeal. So you click on the appeals section and then just go down to the Medicare Advantage Part D appeals section there, and it tells you exactly what you need to do. So. All right. Let's see. Nancy, insurance wanting to be doctors when they have no medical license and dictating drugs you consume. They like playing doctor too much. Yeah, that's the what you're talking about, the Medicare Advantage or Part D plans that they're supposed to have doctors look at that. So when you're talking about a prior authorization or something where your doctor says you need X, Y, and Z, and then the insurance company can second guess your doctor. But the person that's second guessing your doctor is also kind of supposed to be a doctor. They got busted a few years ago. A lot of these Medicare Advantage plans got busted because they were using artificial intelligence to deny. I guess, they're getting around it. It says, well, we call our AI Dr. AI. So that's actually, I'm sure, they play with the law like that. And Congress usually turns their head because they're getting all those. Anyway, so let's see here. Pearl, thank you for all your assistance navigating the Social Security process. You're welcome. I would like to receive clarity on the $1950 a month versus the $23,400 per year when filing early before full retirement age. Yeah, no problem. Again, I've got all of that on my website, but basically the difference 23,000. So that would be under the working and benefits, and it tells you you're talking about the annual versus the monthly earnings limit. So the first year you start your Social Security benefits, you can use either the annual earnings limit or the monthly earnings limit. Okay. So let's say the first year you're under your full retirement age and you're going to start and you've already made $1 billion. So it's June, you've made $1 billion from January to May. And you're like, that's way over 23,400, right? Even in Florida. Anyway, so you say, I can't start my benefits this year. No, that's incorrect. You can start your benefits this year. The first month you start earning under $1,950. Where do they get $1,950? It's $23,400 divided by 12. So the first month you go under the monthly earnings limit, $1,950, and stay under that, then you can start your benefits. So if you made $1 billion from January to May, Social Security doesn't care. You're going to start your benefits in June. And starting in June, you're going to be under $1,950. They'll ask you that. Are you going to be on $1,950 for the rest of the year? Yep, I'm going to be on $1,950. I just gave up my $1 billion income. Okay, perfect. Then you're good. The following year, you have to stay under the annual earnings limit. You can't do the monthly again. You can only do that one time. So let's see here. Take and took. Hey, what's up? Although $2,000 out-of-pocket max for meds with Medicare this year should be a good thing, yes, many prescription drug providers are deciding to stop covering many routine prescriptions in response, seeing this in all specialties. Yes, that's why this year, 2025, I talked about this at the beginning or at the end of last year, that, if you have a prescription drug plan, a Medicare Advantage plan that includes the prescription drug plans, you really, really need to check it, because there were massive changes for 2025. And I think 2026 is also going to be massive changes because we got Dr. Oz in there. And so, this season coming up in October, November is going to be a big one too for 2026, all the plans. That's why I always recommend Medicare supplement plans if you're able to get it. Because you don't have to deal with all that nightmare. You do in terms of the prescription drug plan, because the prescription drug plans change every year as well. But once you have a Medicare supplement plan, you're pretty much good with it for years and years and decades, unless you want to find a cheaper plan. So if you have like a plan F or a plan G or plan N, and you want to save some money by finding a cheaper one with another company because they're all the same, it's just the price. You can do that any time of the year, but depending on your state, you might have to go through medical underwriting, which is just person asks you a bunch of questions, and if you answered no to most of them, then you're usually good. So you can reach out to Chapter there, and they can help you out, see if they can get you into a cheaper program. You can do that any time of the year for a Medicare supplement plan, that is. Lynn, if the big beautiful bill passes and PAYGO cuts Medicare, what will cuts look like? Certain services gone, charge for Part A, increased Part B premium. Yeah, certain services gone because Medicare will have to tighten their belts, and there's going to be a lot of hospitals that are going to go under. There's a lot of hospitals, particularly in rural areas, that are just barely staying above water. But if they get Medicaid cuts, they're going to lose that money. And then they're going to be Medicare cuts, they're going to lose that money. So yeah, there's going to be, unfortunately, a lot of rural hospitals out in the country, out in the desert, that are going to be closing down if all of this happens. Charge for Part A, I don't think that will happen. Some people do pay for Part A, but that's just because they never paid into Social Security enough, the 10 years. So some people do pay for Part A, but 99.9% of people don't. 99.999% probably people don't. So increased Part B premium, that's going to happen regardless. That happens every year. Will they increase more? Possibly. Yeah. But I see a lot of doctors, once the Medicare starts cutting back and they start paying doctors less, some doctors are going to say, you know what, forget it. That's not enough to survive, and the hospitals are going to die, and the Medicare Advantage plans are going to offer less benefits, dental, vision, and hearing and stuff. So that's one of the reasons 2026 is going to be a crazy year. So if you need help coming in October, you can reach out to Chapter. You can call them up now and say, hey, put me on your list for October when the new stuff comes out, and let's talk then. And that's a good way to avoid those scam emails too. It's like someone calls you up and says, hey, I need to talk about your Medicare plan. Says, no, I'm already scheduled. Bye. So just don't say yes. Question. My disabled sister is my dependent. Thank you for looking out for your sister. Appreciate it. Is she eligible for any dependent benefits when I'm on SSDI? Thank you for all you do. No, not from a brother and sister or anything. No, it's dependent. So hopefully she's receiving disability benefits on her own record, either SSI or SSDI or both. So you are probably the representative payee. So you're responsible for her benefits to make sure they go for her welfare. But in terms of her receiving benefits on your record, no. In my YouTube description, I've got a video on there about living on Social Security alone. So check out that video. There's about 50 different programs I talk about. Maybe, hopefully, something in there will help you out. So if your Part D plan stops covering meds, check for it at GoodRx. Then during open enrollment, look for another plan. Yep, good. Exactly. Yes. But if you buy your drugs, outside, like through GoodRx or Mark Cuban's direct company or something like that, that's awesome. You save yourself some money, you get your prescriptions and all that kind of stuff. But sometimes it works against you, because if you have a bunch of other prescriptions that you have to pay for, the money you pay for your prescriptions outside of the system doesn't go against your deductible in your Medicare Advantage or your Part D plan. So make sure you figure that out. So if you just have one or two prescriptions and you can get it outside, then it's usually not an issue. But if you got other prescriptions and you're paying, $100 over here, but you pay $150 over here, but that $150 is going to your deductible, so it might actually save you money. So you just have to work out that long division and make sure you carry the one and all that kind of good stuff. So yeah, it's kind of a difficult calculation, but You know when it's your money, whether you're losing money. So let's see, Keda. I'm 64 on Social Security disability. My FRA full retirement age is 67. Is there anything I have a chance to get extra monies at all, please? No, unfortunately. Um, Once your Social Security disability, it automatically switches to regular retirement benefits at your full retirement age. The check stays the same and everything. Um, but because you're no longer on disability benefits, you're free to do whatever you want. So you don't have to worry about any work limitations. You can do whatever you want, work whatever you want. Social Security doesn't care. And you no longer have CDRs, the continuing disability reviews. And so you're going to be 60, you're 64. So one thing you need to do is to check to see if you're entitled to any spouse benefits, surviving spouse benefits, divorce spouse benefits, because you can get those and your disability. Just one offsets the other. Once you get closer to 65, if you have a Medicare Advantage plan, normally people with disability, that's the only thing they can get is a Medicare Advantage plan. Check to see if maybe you wanted a Medicare supplement plan, but it wasn't available. When you're 65, guess what? It's now available to you. They can't charge you more. They can't deny you. No health underwriting or anything like that. So at least check it out to see if it's good for you. And if not, just keep checking your Medicare Advantage plan every year to make sure it's still the best one for you. Greg, I just applied for my Social Security on the phone today. Check starts in August. The person I spoke with was very kind and called me back promptly. All right, awesome. Greg, give us let us know what that office that is, so we can shout out and say that this particular office is another office that's even the slings and arrows. There's some offices out there are still doing the best they possibly can. So. Alan, retired in the Philippines. I did not receive my retirement Social Security check today, even after I got everything done correctly, talking to Social Security in Manila 2 months ago, and got mail confirming change of address. Now in panic mode. Yeah. So doing everything in Manila, because that's the federal benefits unit in Asia, is in Manila there. And once they do whatever they need to do, then they send it to the Office of International Operations back in Baltimore, Maryland, and then they have to do. So even if you did everything in Manila, that's step one of the process. So yeah, I would reach out to the 800 number, call the 800 number and just say, hey, is it just a day late, or, what's going on? Did you get my routing number correctly, and all that kind of stuff. So yeah, you definitely need to follow up on that as soon as possible. Nelson, hey, what's up, Nelson? If you haven't done so already, don't forget to hit the like and thumbs up button. Yes, please. Thank you. I appreciate it. I am 73 years old. I still work full time. Wow. I plan to retire next year, but I won't have insurance then. What do I do? Then you have insurance from current work. So that means you probably you refuse Part B. You've got Part A if you're receiving Social Security benefits. Hopefully you're receiving Social Security benefits. So you have Part A and you just refuse Part B. You did the right thing by refusing Part B because you have health insurance from work and your employer has 20 or more employees. So you did everything right. Why waste that money? So now that you're going to stop working next year, then go into enrollment periods there on my website, and it tells you are going to be in what's called the special enrollment period. So after losing your job, you're going to be quitting your job. So you had health insurance, and you just need to fill out a couple of forms. And I've got the links to the forms there, the CMS 40B and the CMS L564. And one of those, you just, the request for employment information there, you take that to your employer and they fill it out and say, yes, she did have health insurance since she turned 65. Don't, penalize her. She's good. And then, yep, it's no problem. So about 3 months before you're going to stop receiving the health insurance, then get those forms up, send it to Social Security, and then you can, reach out to Chapter there and find out, what's good for you, whether you want a Medicare supplement plan, which one you want, whether you want a Medicare Advantage plan, which one you want, what about prescription drugs and all that. They can help you 100% free. Peacemaker, if I pass at 61 while on SSDI, will my spouse get my full FRB amount? They're talking about full retirement benefits. unless this is another acronym, I'll pretend you mean full retirement amount. Or my prior SSDI survivor benefits amount when she turns 60, 7 years later. Or does she need to apply for SRBs? Okay, which is reduced. Okay, so if you're on SSDI, then she'll get your full amount, your full PIA, which is at your full retirement age, but it depends on when she starts. If she starts at 60, getting those benefits, then she's going to reduce to 71.5%. She only gets 71.5%. If she starts benefits on your record when she's her full retirement age, she'll get 100% of what your benefit was. So, Jocelyn, I am on Medicare Advantage, and I will now like to go back to straight Medicare. What is the process? So, unless you're moving or losing Medicaid or something like that, you can't do anything until October, because when you sign up for Medicare Advantage, that's a year kind of contract, unless you move or lose Medicaid or there's some other exceptions. But in October, then you can get out of your Medicare Advantage and you can go back to original Medicare and get a Medicare supplement plan at that time. Depending on how old you are in your state, then you'll probably have to go through the health underwriting. But yeah, the health underwriting is just, they don't do a physical or come out to your house and, anything like that. They just, when, like, for instance, you call Chapter and they say, hey, you want a Medicare supplement plan? Okay. This is the time you can enroll. This is the time you can switch from Medicare Advantage to Medicare Supplement. So let's see which one you want. Let's see which one you can get. And if they just ask you about 20 or 30 questions, depending on the company, some companies are a lot more lax. Some have like a 2-year look back versus a 5-year look back. So if you had any heart problems, they say, oh, we only look back 2 years. Another company might look back 5 years. So it's good to know the differences. And Chapter does that every single day. So, hi, need to know what after medical exam, how long does it take for a decision? I'm 63 with bad knee surgery. Nowadays, it takes forever. So, yeah. So you had your consultative exam. So the doctor writes up that, report, send it to the DDS, the Disability Determination Service in your state, and they do all their stuff. But, since DOJ run out a lot of people in all those agencies, it's going to take a while, unfortunately. Under normal circumstances, when I was taking disability claims, we used to tell people, at that time, 3 to 6 months. But now it's about, even before DOJ came in, it was about 6 to 9 months people were telling the last couple of years. And now all bets are off. So what is the max dollar can a person get full retired? Max is over $5,000. This year, for the first time, it hit over $5,000. So that means you paid max into Social Security for 35 years and you waited until you were 70 to collect those benefits. So yeah, over $5,000, first time it reached that amount. Beatrice, I'm 58 years old and receiving SSDI. My Medicare just started this June. My husband is not working and disabled, but not by Social Security. His health insurance is through Obamacare. Can he be on Medicare too? Okay, so if my husband is not working and disabled, no, he has to, well, he's 65 years old, yes. But if he's not at least 65 years old, he has to be on disability through Social Security. And once you're on disability from Social Security, as you know, you have to wait 2 years. So you get approved for SSDI like you, and then you have to wait 2 years for your Medicare to start. So your Medicare started, and hopefully you also find a plan, a Medicare supplement or Medicare Advantage plan that's good for you. If not, you need to reach out and get that started as soon as possible. Senator Whitehouse is a wonderful man, honest, and has a lot of integrity. Oh, awesome. Yeah. If he wants to come on the show, yeah. If anybody knows him, yeah. I'm always looking for people to come on the show so y'all don't have to sit here and listen to me for an hour every single day. Although I'm going to be on vacation. My wife says I have to take vacation. I'll be gone for 2 days and then I'll be back. I need a replacement Medicare card. How do I go about getting a replacement? I cannot find the one I had. Yeah, you just you can go online to mysocialsecurity.gov and request it through there, or just call the 800 number and the 800-772-1213 Social Security, and they'll mail you out a new Medicare card. No problem. And if you have an emergency or something like that you need, they can just, if you don't have your Medicare beneficiary number, your doctor's offices probably have it, so you probably don't even need it. But if you don't have that number and you need to go to another doctor, when you call Social Security, they should be able to give you your Medicare number over the phone, and that way you can just give whatever doctor that one. So, JK, could I volunteer, get paid by the office I may have been accepted by, and not have it affect my subsidized rent amount so I could actually benefit from the added income? It really depends on your subsidized rent, what program you're receiving that from. So if you're, if you're just talking regular volunteer, get paid. So are you talking about the AARP Senior Volunteer Program? Then you're volunteer, but you still get paid. It's not a whole heck of a lot, but hey, every buck's a buck, right? So even if you get subsidized anything, there's usually kind of a threshold where you are able to work a little bit. So you contact where you get that subsidized rent, whatever program you're on, and say, hey, I'm thinking about doing X, Y, and Z. How much can I earn? And then you just work that out with whatever place you go work at, and they'll work with you, I'm sure, because they get the free help. So I got an email from Social Security yesterday about my Social Security statement. Has anyone else received this? Yeah, they if you signed up for Social Security and stuff, that means your Social Security statement is in your portal and your My Social Security. So, yep. But make sure you kind of ignore that email, delete it. Don't click on any links in the email because it might be a phishing email. So just say, oh, thank you for the notification, and then close it out, delete it, and then go to ssa.gov and go into your My Social Security that way. Go directly. Do not pass go. Do not click on any links in your email. So got a crazy answer when I called Social Security today. Okay. All right. Should I continue reading the rest of this? Let's see. Let's see how crazy it is. She said my ex-spouse survivor benefits, married 15 years, were decreased because he remarried. Yes, that is a crazy answer. Yeah, that is zero relevance. That's the person you talked to was a CSR, a customer service representative. They're the hardest working, lowest paid people in Social Security, but they're generalists, and that's impossible. So if your benefits were reduced, your survivor benefits, they're survivor benefits. So obviously, person is not remarried now because he's deceased. That makes no sense whatsoever. So if your benefits were reduced for some reason, it's not because of that. That's impossible. Yeah, that is impossible. No way that's going to happen. Call them up, and again, if your benefits were actually reduced, did you have a student loan? Did you ask for tax withholding? Whatever the case may be, let us know what you find out. Let's see. Stacy, I am on disability. I'm on disability. I turned 60 in November. Am I better off getting widow's pension? Can I keep Medicare? Okay, good question. So you can get both. So you continue to get your disability, but if you're eligible for a widow's Social Security survivor benefits, then you can get that survivor benefits. One offsets to the other because you'll continue to get your disability. Let's say you're getting $700 from disability, and you're eligible for $1,000 from survivor benefits. So you'll continue to get your $700 plus the difference, $300, for a total of $1,000. And because your disability still continues, your Medicare still continues. So there you go right there, Stacy. That is why there's so many people out there on disability that have extra money that they're eligible for, but they have your question and they're worried and says, okay, yes, I can get an extra $300 if I file for surviving spouse benefits. But since that was going to end my disability, I'll lose my Medicare, and I can't lose my Medicare. That's incorrect. You will continue to get disability. You'll get your survivor benefits, or if we're talking about spouse benefits at 62, living spouse benefits, divorce spouse benefits, whatever. But your disability will continue, and because your disability is continuing, your Medicare will continue. So, yep. But remember, if you wait for that widow's pension, it increases. So if it's only like, let's say the surviving spouse benefits is only $50 more because you're 60, you're taking a full reduction. You're taking, 30%, you're taking 71.5% of that benefit amount. Every month you wait, that benefit goes up. So if you call up and they say, yeah, you can get $50 more a month, then say, okay, well, what if I wait a year? How much? And they say, well, then you'll get $75 a month. And what if I wait 2 years? Okay, it'll be $150 a month. So you make that decision based on, what you need. So let's see. Slimby helps pay for prescription drug premium deductibles. It reduces your out-of-pocket costs. Yes. So you are talking about the Medicaid. And let's see here where I've got the dual eligibility. So there's dual eligibility. There's different categories of dual eligibility. Slimby, Quimby, QMB. So if you're having a hard time, you or someone having a hard time paying that $185 a month, reach out to Medicaid, file for Medicaid, and get some extra benefits. And they just might pay for your Part B premium, the $185. So that puts an extra $185 into your pocket. So let's see. I applied to start Social Security this year in late March. My birthday is June. I am still waiting for status update. Should I be worried? I am also unable to see my estimates. Yeah, once you file for benefits, there's a kind of a glitch in the system. Once you file for benefits and you have an active claim pending, then sometimes you can't get into your My Social Security account. So it's just a weird thing. So doesn't really mean anything, just computer thingy. So you applied in March. Your birthday is in June. When birthday doesn't matter, unless you're talking about 62. But if you turn 62 in June, then you're not, unless you were born basically on the first of the month, you're not eligible for benefits until July, and you'll get your first check in August. So it depends on what we're talking about here in terms of whether you're talking about 62. Trump just said he's not withholding Social Security benefits from student op loans. Yeah, I didn't see that. The Treasury offset program was reinstated. So not sure if that's something that just came out the last couple of minutes. Yeah, I'll check that out. But everything I've seen on there, if you have a student loan offset, then 15%, or a student loan default, then 15% can be withheld from your Social Security. I just saw something this afternoon from the Trump administration stating that they were not going to take 15% away from Social Security recipients. Don't know if it also applies to Medicare or not. Yeah, well, Medicare, yeah, it would never apply to Medicare because you don't get money from Medicare. So, yeah, if that is a proposal or if it's a statement, because right now TRO is back on. So the Treasury offset program is still on. So he would have to change that law or stop that law or amend that law. So yeah. If you've got the official source on that, and I go into SSA.gov every day, and it doesn't have any type of communications that Social Security is now exempt from that Treasury offset. I mean, any other type of benefits, like if a tax returns, they can withhold your tax return if you're in student loan default. That would stop during the Biden administration, and but the current administration restarted that. And with restarting that program, then any type of federal monies coming in, they can take your income tax return, and for Social Security, they can take 15%. So Congress would have to have changed that law or stop that law. And I haven't seen anything on that. Maybe statements that they change their mind, but until it becomes a fact, yeah. How are we supposed to use monies for doctors or dentists if these people refuse to Medicare money when they don't like, don't, it's, yeah, I'm not sure exactly what. The specialized low-income Medicare beneficiary program pays your Medicare Part B $185 premium if you qualify. That is correct. The QIMB does, the QMB, the Slim B, the QI. It depends on the state as well. Some states are strange, like Arizona, they have ASEX, access. Yes, that's the acronym they use. So let's see here. I saw something. Oh, okay. That's the same thing that they were not going to take 15%. So again, if it's just a statement, but it actually has to be backed up by an actual, yeah. Why is someone who does not get? I hope that's a fact. Yeah, I mean, 15%. I hope they do not withhold, 15% of people's Social Security benefits because of Social Security default. Well, unless you've got other income and you're making the $5,000 a month, then yeah, go for it. But usually those people don't go into default. The people that go into default are low income workers, and a lot of those are just living on Social Security alone. And again, there's that floor, the $750. If all you get is $750, then they can't withhold the 15%. But if you make over 750 to 2,000, and that's all you get. That's barely scraping by. And now they're going to hold 15% above that. So I hope that is the case. I definitely hope that's the case. So I have been collecting Social Security since I was 62. I turned 66 in 10 months in June. Do I need to notify Social Security once I turn 66 in 10 months, or would it automatically continue? Yep, it'll automatically continue. Nothing changes. You will continue to receive your benefits. And you started at 62. One thing it might change is if any benefits were withheld because you were working anytime since you started receiving benefits at 62. So, because if you started your benefits at 62, you are fully reduced, But if any checks in the last few years were stopped because you went over the annual earnings limit, then your benefits will be recalculated automatically. But if no benefits were ever stopped because of work, then nothing's going to change. You're good. Let's see. Went to a dentist today, $400 to pull one molar. Medicare needs to add dental to the plan. I agree. That's ridiculous. I can't get Advantage until October. Sucks. Really need a dental plan. Yeah, even I'm not a big fan on dental plans. Particularly on stuff like that. You pay on a monthly, and it's one of those things where, okay, here's your monthly, premium, and for the next 2 years, we'll just cover cleanings once every, year, twice a year, something like that. And under that, they don't cover it. So if you get a dental plan now, they probably wouldn't have covered that anyway. Again, depending on your dental plan. So the best thing to do is just contact your dentist and, try to come up with some deal, or say, okay, hey, what dental plan do you recommend? Do you use? And they'll tell you about it, and they'll say, well, again, they'll probably tell you exactly what I just told you. So sorry to all those people out there signing people up for dental plans, but yeah. Is the Medicare appeal the same as a peer-to-peer review done with private insurance? A Medicare appeal. I'm not sure. What are we talking about? A Medicare appeal? A Medicare Advantage appeal? That's, a Medicare appeal. There is no real Medicare appeals. If the doctor says you need it, then that's done. You don't have to appeal anything through Medicare. I guess unless you're saying that this is not Medicare itself say that's not medically necessary. Like if I went to try to get a hair transplant, they would say no, it's not medically necessary. I would argue, and I would appeal that probably. Well, anyway, but in that case, yeah, you would just submit it to your doctor, and your doctor would say, well, no, it is medically necessary. Have you seen this guy? Pink Owl, it's okay. I just want to make sure once I get close to 67 that I don't need to contact Social Security. It saves me a phone call. Yes. Yep. Once you do that, once you reach, yep. So it looks like Pink Owl is out there answering questions, and she's always, or he or she is always good. So we've got regular viewers that always help out. So we appreciate it. Any downside of applying online versus in for the first time Medicare benefits? No, no. Either way, it's a nightmare now because Social Security is so low staffed. If you apply online, a human being still has to look at that case to make sure everything is cool and copacetic. So if you file on, if you go in office or file over the phone, you talk to a human being as well. So whatever's good for you. Whichever way is going to take, unfortunately, a while because they're just so short staffed. And it's been like that for a while, but now it's even worse. All right, let's see some people I don't recognize. Carrie, Medicare Advantage plans make it impossible to use all their so-called benefits. CS gives you wrong info, do not help you obfuscate, wear you down. Customer service. Yeah. That's one of the reasons my son and I chose Chapter is because they've got a called a member success team. And that's what their job is, to help you file, appeal prior authorization denials, help you with tiering, help you, requesting Medicare exception or, for your prescription drugs and helping use, they've got a over the counter app they just came out with. So yeah, it's good to have someone else in there in your corner. So that's why one of the reasons we picked them to help you all out. Car became a member, gold member. Oh, thank you. I appreciate it. You're too awesome. Thank you for support. What is going to happen to the SSI program under Trump? Under the current administration, nothing has happened yet with SSI itself or SSDI. One of the issues is that's not good. With all the previous administrations for the past 30 years, if they need to solve the problem. And one of the is the Medicare and Social Security Fairness Act. But SSI, that's the welfare-based program. And maybe, as of right now, no. But if the Medicaid and all that other stuff is an indication, there might be, work requirements to get SSI. But for SSI, the reason people are able to get SSI is because they're disabled. If you're under 65, you can get SSI if you're disabled. Or aged 65 and older. So those are the categories that are supposedly exempt under the new big beautiful bill. Is if you're on Medicaid, but you're on Medicaid because of disability, then you don't have those work requirements. And if you're 65 or older, you don't have work requirements. So if that continues, then SSI should be good. So as of right now, no changes. But I'm watching it, and if anything happens, I will let you know. The only thing they could change on that is, or they could change anything they want, but probably on something like that, if, they do the same thing they did on Medicaid, is where they double up the reviews, the RZs, the redeterminations, limited issues, where people on SSI get reviewed. So they might do more reviews. And the problem with that, okay, more reviews, good, that's fine. But if you don't have staff to do those, then, the letters go out and they tell people to provide X, Y, and Z proof. You send it to the Social Security office and there's nobody there to look at it, and you get canceled. That's what I'm afraid that's going to happen to Medicaid. Work requirements, okay, fine, whatever. But a lot of people are collateral damage are going to fall through the cracks and lose their Medicaid and lose their prescriptions and lose their ability to go to the doctors, even though they are eligible. And how do I know? Because that's exactly what happened during the Medicaid unwinding that happened a couple of years ago. 75% of the people that were kicked off were in fact eligible. So reach out to your congresspeople and tell them, hey, go after fraud, waste, and abuse is a beautiful thing, but don't use that as an excuse to kick off people that need it. Mama, so if the people who get Medicaid and Medicare lose their insurance, then that means the healthy people could get sick because the sick people can't afford to see a doctor. Yeah, we'll just go back to the old days where, the emergency room became your primary care physician. So, and then people will stop going to the doctor when they have an issue and wait for it to get worse, and it'll cost everybody more money. That's been proven. It just, yeah. Let's see here. What's the criteria about food stamp benefits? Yeah, that's through the state, and low income, low resources, and other situations. If you're a young adult, not disabled or something like that, without kids, and it's difficult. If you're homeless, it's easier. But yeah, you reach out to the state, and there's different requirements on each state in terms of income, resources, living arrangements. Jose, my uncle's wife passed. He's on SSI, and he got denied her retirement benefits. Is that normal? Yeah, if he's okay, SSI is the welfare-based benefit, and so nobody can get SSI from someone else. So um, so unless you're talking about something else, if you don't mean SSI, if you mean just regular Social Security, then he got denied. He got denied her retirement benefits. Okay, so possibly if he's receiving higher benefits on his own record, then that's why. He didn't get denied. It's just he's making more on his own. So if you don't mean SSI, if you just mean regular Social Security, then that's it there. So one day people would tell the difference between SSI, but yeah, everybody, makes that mistake. I'm 64 on SS, just like the next person. This actually this person might actually be on SSI. I'm 64 on SSI only with Medicaid. Okay, then you probably are on SSI. Will I lose Medicaid at 65? Not naturally, no. If you're, unless you win the lottery between now and then, or big inheritance. But no, if you're on you are on Medicaid, and if you still qualify for Medicaid at 65, you'll get Medicaid. But you just might also get Medicare as well. But if you're only on SSI only, maybe you never paid into FICA, so you might not get Medicare. But here's a lot of people don't understand, don't know, is that because you're receiving Medicaid from the state, sometimes the state will decide to pay for your Medicare because it's cheaper for them. So if, for instance, they say, hey, this person's costing the state $10,000 a month because of their health needs and stuff like that, and they just turned 65, they're not insured for Medicare, they can't get Medicare free. The $185 we'll pay for, that's no big deal. They'll get their Part B, but Part A, they're not eligible for free Part A. And that's, maybe $400 or $500 a month. But they might say, but if we get that, then that's going to save us money. So some states will do that. They will pay for your Part A premium, the $400 or $500, and that saves them money. So it's basically one government agency kicking, cans, the costs to another agency. So yeah, that's basically what the big beautiful bill is. It's just, kicking people off Medicaid, and then people are still going to get sick. They're still going to get sick. They're still going to get injured. They're still going to fall, and whatever the case may be. But they're not going to have health insurance. So they're just going to go to the emergency room, and it's going to cost everybody so much more. And the hospitals are going to have to take that hit because they don't have an insurance, but they still have to take care of those people when they walk in the emergency room. And so it's going to end up costing us all more. So Mark Cuban also has an online drug prescription service. Yes, I've had some people that like that. So, hey, Mark Cuban, if you want to come on the show and tell us about your program. So, yep, I'll do it to it. I retired at 66 on my benefits, and divorced, was married for 20 years. He's not retired yet. He's 65. Can I collect under his benefits? And he was in the military 20 years. Who do I contact for that? For the veterans, you contact the Veterans Administration. But if he doesn't have to be receiving benefits. It's called independently entitled divorce spouse benefits. So go on to my website there, click on the family, and then click on independent divorced. So basically, and I've got the reference down there for it. So it doesn't matter that he's not receiving benefits. You are filed for benefits on your own record. You're receiving benefits on your record. If your benefit amount is less than half of his, then you can file for benefits on his record. It doesn't matter whether he's receiving benefits at all. That's what's called independently entitled divorced spouse benefits. All right, we are at an hour, and sorry I can't get to all the other questions there. Oh, we got Herbert Tim Peel became a member. Thank you, appreciate it. Thanks for the support. But I will be back in a couple of days, and I'll do this again. Y'all take care. Please take care of each other. Y'all have an awesome